Okay, this is for the men who are watching or for those who love them and care about them. June is Men's Health Month, so it's a great time to encourage each other, to focus on our health and take good care of ourselves. In fact, the CDC says that more than 13% of men over 18 are in only fair or poor health. Come on, guys. If you've been putting off that checkup, now is a good time. If you don't believe me, you have to believe Dr. James Kuan, Medical Director of Providence-Swedish Urology. And thank you so much for being here, Dr. Kuan. Stats show that it is challenging to get men to go to the doctor. Why is that?
Well, there's actually studies to say that 70% of men would rather do house chores or, things around the yard.
And that's saying something.
Right, than go to the doctor. And it's important, though, that men take that first step to go to the doctor, because we can't provide preventative health care if we see you only when you're unwell. And so getting to the doctor before you're unwell allows you to have a captain to steer the boat, let's say. As specialists, we're part of that team, but people tend to do better when they have a primary doctor to steer the boat when their health goes sideways.
Now, a lot of men won't admit this, but we are afraid of the unknown. So what can you expect when you go to a wellness check?
Well, fortunately, we're not going to be as anxious as a lot of men are. And so we understand that men are anxious. And I think that there's a few things that men can do. Bringing a loved one, someone who's important, a friend or family, to be a second set of eyes and ears matters. I think simply telling the person who's rooming you, the medical assistant or the nurse, or even the doctor, that you're nervous or anxious, that sort of helps us set the stage so we know where to start.
Yeah.
And of course, you want to talk about the things that are on your mind. So making a list of questions.
You want to prepare then. You want to think, sit down and really think it through. Look, this is my shot. This is my chance to find out anything I can about my own body.
I got my 15, my 20, my 30 minutes, whatever the time.
Yeah. So what would be some of the maybe sample questions you might want to, just food for thought to kind of start making that list?
Well, of course, there's going to be, how is your current health? What's happening? Are there specific things that brought you in? But specifically for a wellness, and especially if it's a new doctor that you're seeing, you'll want to review your past medical history, past surgical history, bring in a list of medications, supplements, allergies, things that may affect the way that the discussion goes. And then, of course, there's going to be questions about immunization status and sort of mental health and those things that then segue into either physical examination, testing, and then, of course, there's a number of screenings, general type things that are recommended for all men.
What kind of cancer screenings?
The importance of cancer screening is to identify cancer at an early stage where it is more treatable. And as a result of advances in treatment and screening, we're fortunate that survival rates have improved over the last several decades. Specifically, family history will dictate in some men a different pathway for screening. But generically, we would talk about lung, prostate, and colorectal cancer for men, in addition to just general screening for skin cancer. With regards to lung cancer, if you are between the ages of 50 and 80, a current smoker or a past smoker having smoked for 20 years, your primary doctor is likely to recommend lung cancer screening, probably with a low-dose CAT scan. Prostate cancer, an area that I see a lot of, starts usually in our 50s. It is important to consider screening in our 40s for men who have a family history, that's a brother or a father with prostate cancer, or African American men, because their risk is higher. And so screening in the 40s or 50s in average risk men usually starts with a prostate examination and a blood test called the PSA. PSA is not a diagnostic test. There's some discussion and controversy in sort of the press. That said, I think of it as a screening test for other investigations like a biopsy. A prostate biopsy is how we diagnose cancer because enlargement, infection, and cancer can cause it to go up. And so we need more information if it rises.
I'm asking for a friend. What about men's sexual health? It's a difficult topic for a lot of people to talk about.
It is a difficult topic. It's a topic that I talk to lots of men about every day.
Really? So we shouldn't be nervous if we have a concern. I think a lot of guys probably they probably go to, and once again, I'm asking for a friend, they go to the exam, they leave and they go, oh, darn it, I just couldn't go there.
Yeah, it's okay to be nervous, and what I think happens to what you've just said is a lot of men go for something else when really what they wanted to talk about was sexual health. And they often piggyback it in the last 2 minutes as someone's writing the prescription or getting up.
You're like, hey, by the way.
And you leave feeling brushed off, or that it wasn't taken care of. And so two things. I recommend, making a specific appointment, or at least letting them know at intake on your paperwork that this is a topic that you want to discuss before you leave, so that in advance we can prepare and make time for that.
Okay, tell us a little bit about your area of urology at Providence-Swedish. What kind of work goes on there?
Well, as urologists, we deal with surgical treatment of the urinary tract, from the kidney all the way down to the urethra in men and women, and we also deal with reproduction and sexual health for men. And specifically, I deal with men's health, which deals with prostate enlargement. It deals with vasectomy, fertility evaluation, and then disorders of the penis and the testicles. And in that, it has allowed me to have a practice where I'm able to help men, not necessarily with the treatment of prostate cancer, but how they recover and how they survive and how they restore a normal quality of life after they've had cancer treatment, maybe leaving them with urinary problems or sexual problems. And so it's a very rewarding part of my practice that I am able to give this back, because no man asks for prostate cancer.
Yeah.
We can provide medical and surgical treatment for men's health conditions, but a lot of these discussions can actually start with your primary care, who can initiate screening, who can initiate treatment. And in many cases, you may never need to see us.
They funnel the right people to the right medical care. Well, thank you so much, Dr. Kuan. It's very eye-opening discussion. Whether you've been putting off care or you need a follow-up, be sure to reach out to Swedish Primary Care today to get and to stay healthy. Coming up, it's summer renovation season. We'll tell you how to know which type of roof is right for you.
This portion of New Day Northwest is sponsored by Providence-Swedish.